Hey everyone, Dr. Gage here today. Today we're going to talk about all things imaging. Now, a lot of chiropractors will utilize imaging. We utilize imaging here at HealthFit, but some offices will utilize imaging with every patient who comes in through the door. Other offices hardly ever use imaging. So today we just kind of want to discuss what we view as when imaging is needed, about imaging, the types of imaging, and then what care can look like after getting some sort of advanced imaging there. So our first question here is what constitutes imaging? Now, we will typically order imaging if there is things in the patient presentation that we'd consider called yellow or red flags. Now, these are signs or symptoms, a combination of things often, which could lead us to believe that there is something more serious at play here than a standard musculoskeletal condition, and that we want to have that clinical knowledge to advance treatment going forward from the imaging results that we would receive there. There's three main types of imaging that most chiropractors will utilize, and that is X-ray, MRI, or CT scan. Now, CT scan is very rare. It's typically more so in the MRI or X-ray category here. Now, X-rays do a great job at letting us know, structurally with the skeleton and with bone, what's going on, if there's any concern there, any pathology there. And then MRI is a great job at also not only seeing the bone, but also seeing soft tissue in the area. So that's where we can utilize MRI for things like muscle tears, strains, things like that. Any sort of concern with soft tissue related structures in the area, we can get an MRI for. And that would include things like disc herniations as well there. So once you get your imaging done, you'll then receive an imaging report, and we'll receive one from the imaging center as well. And on there, there's kind of two main sections I like to go over with patients. The main bulk or the body of the imaging report is going to be the findings section. Now, this will include normal and abnormal findings in that section, okay? So not everything you read under the findings tab is necessarily bad per se. That's just our overview of all the structures in the area. And then the impressions portion of the imaging report there, that's kind of like the spark notes or the summarized version of the abnormalities there. So I typically will describe some of the findings there, but we really want to focus on the impressions portion there. And then the question becomes, now what? So we have that clinical knowledge of what's going on with the soft tissues, with the bones. We can rule, in or out diagnoses that we had suspected prior to the imaging. And so then now where does care go following that imaging? So if you've watched our video on the healthcare funnel, it was discussed that after imaging, we can then return to our conservative care treatment plan there, and we can alter that. We can keep on the same path. And we can, continue on with conservative care there, or maybe some of those imaging findings in the impression section there lead us to want to work towards that end of the healthcare funnel there where we do a referral. So, and then what's nice about that is if you have that referral, you also have the imaging for when you go visit that ortho, that neuro, whatever referral is necessary for that going forward. So that's one thing that we just wanted to talk about here is care following imaging doesn't always mean that care needs to change. It doesn't mean that you can't come back into the office here, but it'll allow us to better plan for continuing with treatment there in whatever realm and things going forward with your condition there. So this is our quick overview on imaging. Take care. I'll see you guys in the next video.